Matthew Holt, I have a conspiracy theory brewing over here. I saw on Twitter last week, Glen Tullman splashed up outside of the NASDAQ, like larger than life, 90 feet tall. Then today, I see him inside NASDAQ on a show talking to somebody. How much longer do we have to wait for him to be on the NASDAQ with Transcarent? We went from up outside it to inside to on. How long we got to wait?
I know. He can deny both that he's going IPO, that Transcarent's going IPO, and he can also deny that he's Q, just because we have conspiracy theories, and why not?
All right, conspiracy theories abound. It's the December 9th episode of Health in 2.00. Did you say he's going to deny that he's cute? Like C-U-T? What did you say?
No. Deny that he's Q. Like the Q,
like the letter
guy,
Q.
The mystery guy behind QAnon, the conspiracy theory.
Oh my God, that's not at all what I thought you said.
We started talking about conspiracy theories. That's the biggest conspiracy theory out there. There's this guy called Q, and he does, it's a lunatic theory. And that all these people have denied there is.
That rumor? No.
Okay. Well, how many times did he deny that Livongo was going public, including after it had gone public? You know, it was like, anyway.
That was my favorite thing ever. This time I want him to deny that Transcarent has gone public to me while confetti rains down upon us on the floor of the NASDAQ. Having just come from ringing the bell. And he can also deny to me that he's cute and that he's Q from QAnon. There you go. He did it all there.
He's well practiced at doing that. By the way, talking about denying IPOs, apparently, so Blake Dodge at Business Insider is out with Included Health, or the former Grand Rounds Doctor on Demand, whatever thing. Owen Tripp, apparently they're going to be doing an IPO. Very exciting.
Exciting times here.
Well, that would make a trifecta, right? Because now you've got Transcarent denying it, Included Health about to do it, Accolade's already public, Raj Singh, and they were all on your navigating the way out of the...
No, but nobody's a navigator anymore. We have next to the navigator name.
They're all navigators.
Advocator, integrator, care provider, finance fixer, whatever it is, the three not navigators.
Three non-navigators are all going to be
not navigating.
Non-navigating. All right. Meanwhile,
Matthew Holt, time out. We need to, for Christmas, gift all of our loyal viewers that video of that panel with Glen Tullman and Rajiv Singh and Owen Tripp, because that panel was a gift that keeps on giving.
Feisty. There was some feisty. Yeah, we will get for Christmas a bunch of that.
Elbows were thrown. Elbows.
From the What's Next Healthcare Policies Techies VCs conference, we have a bunch that we need to get out there, and we'll get some of that for next year. And then we will tell people what might be happening next year with that particular conference and other stuff. Maybe.
As soon as we know. Okay, get your timer ready. We actually have deals that we need to go through right now.
All right.
All right, here we go. 2 minutes on the clock, and we're going. If you are a natural language processing digital clinical assistant helping with physician burnout, today is your day. 2 startups get money. Suki gets 55 million, bringing their total to 95. Robin gets 50 million. Matthew, you told me they do exactly the same thing. Tell me more.
All right. Well, it depends who you love the most, right? Because Khosla Ventures and Northwest are in Robin, Phillips with March Capital, but also the Venrock and Flare Capital are in Suki, run by Sumit Pony. Suki was way back when at Health 2.0, just even before they launched. They do exactly the same thing, right? This is ambient recording to the avoiding, so people don't have to write notes in the doctor's office. There are a bunch of other companies trying to do this. Nuance is the big one here. They've got which is now part of Microsoft. They've got a similar offering, and everyone's trying to fix this out. No one's quite ready for prime time yet, but they're getting there. And soon doctors won't have to write notes and they'll be very happy. But for now, good luck to these guys.
Stop fake money. Cerebral gets $300 million, bringing up their total to $420 million. Holy moly, Matthew Holt, more money for mental health.
They have grown incredibly fast, right? Cerebral is incredibly fast growing, and it's got a bit of a reputation for dispensing, pills a bit like candy. But in the mental health space, it's got some studies that say that it works, and they're They're doing not just depression and anxiety, but a bunch of other stuff, including some, heavier stuff like PTSD as well. So to be continued. A lot of people are a bit suspicious about these guys.
All right, 110 million goes to pop-up mobile health clinic company Nomi. Tell me more about this one.
Talking about suspicious, I mean, God, these guys are raised money very quickly, built a bunch of stuff in the pandemic, got a bunch of state contracts, and one some from Tennessee that later got canceled, have some weird influence from the state of Utah. So they're from Utah. Their main backers, Rose Park Advisors, are a Boston-based VC fund, the son of Clayton Christensen, who was not to do conspiracy theories, who was a Mormon, right? Great business school professor. Mm-hmm. I had a look at them. All of their deals are with digital health companies, all based in Utah. Utah gave them a deal to do COVID testing, and somehow they've spun that into this mobile clinic platform. There is a lot more to this to meet the eye. There's a couple of articles about them which are a bit suspicious, but they are part of that move, like carbon and to some extent more medical and others, to like, can you get a branded national ability to deliver care? They've also done some good stuff. They paid off a lot of medical. They put in some money to pay off a lot of medical debt. I think it cost them a couple of $1 million to pay down a couple $100 million worth of medical debt. So interesting, kind of, but one of these sort of pandemic stories out of left field. A lot of somewhat interesting issues there. We'll see how they do.
I love when we start with conspiracy theory, move into gossip, and then end with suspicious storytelling. I love it.
Well, yeah, it is interesting, right? Because this happened in the UK a lot, right? A lot of the government. So the health secretary of the UK gave a £45 million contract for PPE to his pub's landlord. And apparently nobody seems to think something wrong with this. Well, it's been
is Guinness a form of PPE now? Like, what is happening there?
Well, the pub was shut down and he had to be nice to the guy, and so he got a $45 million. Yeah, there's a lot of stuff. Your buddy and mine, Brent Stackhouse, was helping get PPE for his place, for his Mount Sinai in New York.
For Mount Sinai in New York.
There's a big scandal where the state of New York and Presbyterian, I think Sinai, a bunch of others, paid in to get some PPE from somebody in China who just.
Oh my God! There were multiple people on LinkedIn who tried to fence PPE through me. Like, I was in a fence. They're like, "Hey, I've got like 15,000 masks. You know, anybody could use them." I'm like, "Get away from me! I am not a fence for like PPE. Are you kidding me?" What?
Well, a lot of stuff happened during the pandemic.
Yeah, I can move that. Just send it over.
Not all of it above board. Let's be clear about that.
I might be Italian and know what to do when things fall off the truck, but I don't know how to get rid of that much PPE. Like, what are you doing? Why would you call me?
The amount of people who have like been busted having, created 25 fake companies and pulled down 20 million in PPP loans, then disappeared. There's a lot of stuff going on.
Oh my God.
Yeah. So hopefully Nomi rises above the fray, but the fact that it was a guy who didn't have any experience in this business and managed to put this together based on a bunch of state loans, Republican political operatives in those states, governors. You should read the one in Tennessee. It's pretty suspicious, but maybe a real company comes out of it. Maybe.
I look forward to the tweet stream.
You don't have to look far. You don't have to look far for me to find corruption and double dealing and malfeasance in health tech, so healthcare.
Which is all of the reasons why you should follow him over there at Baltiboy on Twitter.
I haven't even mentioned University of Miami hiring a new football coach with the money they made.
I saw that one.
And getting exactly enough in CARES Act funding to pay for the football coach and firing the old football coach and paying off the University of Oregon, whose football coach they're stealing, to pay off their contract. Yeah. Universities, healthcare, college football, all equally corrupt.
Conspiracy theory. If you would like to sponsor the conspiracy theory jingle over here at Health in 2.00, reach out to me on Twitter. I'm at Jess and I'm happy to sing that whenever it comes up. Sponsored by yeah, and the healthcare blog. Go over there, sign up for the newsletter. Lots of exciting blog posts which go deeper into said conspiracy theories, gossip, and scandalous stories.
All right, you've been doing the CB Insights thing all day. Are you doing it today as well?
Yes, I am. So I will be there again, wrapping this thing up. It's a good event. There's a ton of people I've interviewed who are in it. Some of our sponsors are on there. There's a lot of demos. It's been good. It's been a great event. They announced their Digital Health 150. So now we can all update that chart in our PowerPoints. So we don't have to keep using the one from last year.
Shall I give you my conspiracy theory about CB Insights? No. Let's get us out of here. Bye-bye.
Why he's so fun in person at happy hours at conferences, folks. Can't wait for that to come back live and in person. Until then, all right, guys, we'll see you tomorrow with more, or we'll see you soon with more information, gossip, scandalous stories, rumors, and of course, the conspiracy theories. Conspiracy theories.